Welcome everyone to today's webinar. Thank you for joining us for today's discussion on medical legal partnerships. My name is Kezia Ofosuata. I serve as a policy assistant here at Groundwork, Ohio, and I'll be your moderator for today's conversation. Before we begin, I would like to state that today's webinar is being recorded and closed captioning is available. Additionally, all participants are advised to stay muted. We encourage you to forward your questions to our Q&A box. We have a full agenda today, so if we can't get to your question during the event, we will follow up after the event if you provide your email address with a question. Lastly, all participants will be forwarded the recording of the event and its materials after the conclusion of the event. I will begin this panel by giving a brief introduction on medical legal partnerships and its place in House Bill 7. I will then introduce our wonderful panelists that we have for you, and each panelist will then take 5 minutes to give their brief remarks on House Bill 7 and medical legal partnerships. I will then ask each of them a few questions, and we will conclude with a Q&A session from the audience. And if any questions come up during the webinar, please feel free to drop it in the Q&A chat box throughout the course of the webinar as well. Also, please remember to follow Groundwork Ohio and our panelists on all social media platforms. Today's webinar is brought to you by Groundwork Ohio. Groundwork Ohio is a nonpartisan public policy research and advocacy organization formed in 2004 that champions high-quality early learning and healthy development strategies from the prenatal period to age 5. We lay a strong foundation for Ohio's kids, families, and communities. Groundwork Ohio houses 3 centers of excellence: the Center for Maternal and Young Child Health, the Center for Early Learning, and the Center for Family Voice. Today's webinar is a product of the Center for Maternal and Young Child Health. Groundwork Ohio works hard to advance quality early childhood systems in Ohio by engaging, educating, and mobilizing diverse stakeholders and strategic partners to promote data-driven and evidence-based early childhood policies. Thank you for bearing with me through the few housekeeping items. We will now begin the webinar. House Bill 7 was introduced in the Ohio House of Representatives on February 15th, 2023 by Representative Andrea White of Kettering, Ohio, and Representative Humphrey of Columbus, Ohio. This bill is titled the Enact the Strong Foundation Act and was created to support strong foundations for Ohio's mothers and babies in their first 1,000 days to address maternal and infant mortality, thereby improving health, developmental, and learning outcomes for babies and mothers. This bill comes with strong provisions aimed at fulfilling this goal. The Medical Legal Partnership Grant Program was included as one of the provisions in this bill. Medical legal partnerships link the expertise of healthcare providers and legal professionals to address legal issues that adversely affect the health of patients. Today, we have a distinguished panel here to talk with us about the importance of this program to the future of healthcare and legal access in Ohio. Thank you so much, panelists, for joining us today. So the first panelist I will introduce is Dr. Robert Kahn. Dr. Kahn is a professor of pediatrics and associate chair for community in the Department of Pediatrics at the University of Cincinnati College of Medicine. He's also the vice president of health equity strategies and leads the new Michael Fisher Child Health Equity Center at Cincinnati Children's Medical Center. Dr. Kahn serves as the lead for the hospital's Community Health Strategic Plan, which aims to help ensure Cincinnati's children are the healthiest in the nation through strong family and community partnerships. This plan focuses on excellent and equitable child health outcomes, all children achieving full potential, and safe and supported families. Dr. Kahn's own interests lie at the intersection of poverty, racism, and child health, examining what leads to worse health and where we might intervene most effectively in partnership with families and community agencies. His research focuses on common pediatric conditions through clinical quality improvement and population lenses. Dr. Kahn attended Princeton University and Vanderbilt University School of Medicine and did his pediatric residency and fellowship at Children's Hospital in Boston. He obtained a master's in public health at Harvard School of Public Health. Welcome, Dr. Kahn, and thank you for joining us. The next panelist I will introduce is Elaine Fink. Elaine Fink is a managing attorney at the Legal Aid Society of Southwest Ohio, an affiliate of the Legal Aid Society of Greater Cincinnati. Legal Aid's mission is to resolve the serious legal problems of low-income people and reduce poverty through effective legal assistance. Elaine manages Legal Aid's Center for Health Equity and Advocacy to develop programs to utilize legal advocacy to address social determinants of health, to advance health outcomes, and improve health and race equity. In coordination with healthcare partners at Cincinnati Children's and TriHealth, Elaine co-created Cincinnati Health Law Partnership, also known as Child Help, and the Maternal Health Law Partnership, also known as MHELP, to reduce race-based disparities in health outcomes for children, families, and pregnant women. Elaine manages Legal Aid's engagement in the Health Equity Network. As the managing attorney for children and education advocacy, Elaine leads programs to increase education success and stability for vulnerable populations, including kids in school rule, a program for students in foster care, and the Teen Child Program for students in the juvenile justice system. She uses her leadership to build engagement across school districts, to decrease implicit bias, race-based disparities in school disciplinary removals, and to build the capacity of school systems to respond to trauma and education equity. Elaine graduated from NYU School of Law as a Ruth Tilden Snow Scholar and Arthur Garfield Hayes Civil Liberties Fellow. She received her bachelor's degree Phi Beta Kappa from the University of Michigan. Elaine's leadership and advocacy were recognized by the Ohio Legal Assistance Foundation in 2016 with the Dennis Murphy Award and by Lighthouse Youth Services in 2018 with the Beacon of Light Award. Thank you, Elaine, for joining us here today. The last panelist I will introduce is Susan Yeagers. Susan Yeagers fills the role as the director for the Ohio Poverty Law Center. The Ohio Poverty Law Center advocates for policies to reduce poverty and increase access to opportunities and justice for all Ohioans. OPLC draws on the day-to-day experiences of Ohio's legal aid attorneys who provide civil legal services to low-income Ohioans to drive Ohio policy agenda. From improving access to health care to removing barriers to employment, they focus on changing and addressing systems and policies that keep people in poverty. Susan Yeagers joined the Ohio Poverty Law Center as its director in February 2018 after 10 years as a government affairs and communications consultant. Prior to that, she was the director of the Government Relations Department of a large Ohio nonprofit and was co-chair of the successful 2006 Smoke-Free Ohio campaign. Susan served 8 years as a member of the Grandview High City Council and holds a BA in American Studies from the University of Dayton and a law degree from Case Western University. Thank you, Susan, for joining us. Now I will give way for each panelist, starting with Dr. Kahn, to give their brief remarks on medical-legal partnerships.
Well, thank you so much for having us, and real pleasure to get to share with you today a little bit about medical legal partnerships and how critical they've become. So my job as trained as a pediatrician, is to convey the practical expression of what they are. And basically it's a new way of practicing medicine. It is a close collaboration between clinicians and legal advocates to achieve outcomes that neither one of us can achieve alone. And so practically speaking, I'll just give, our setting. We have 6 primary care practice clinics. We have over 60,000 visits per year, 30,000 patients, 85% or more are insured by Medicaid. And the challenges they face are all the usual clinical conditions that all kids face. And then on top of that, the double jeopardy often of living in poverty. So their asthma is more poorly controlled, often because there's not a pharmacy nearby, or a car is not owned to go get the meds, or the housing quality and stock is poor, or they have a harder time, their parents advocating for their well-being in school. And so as we're trying to move through 60,000 visits a year doing usual clinical care, on top of that is this layer of hardship that families are experiencing, and the fatigue and exhaustion of trying to deal with all of those issues while doing everything they want to do for their kids. And so the vision, which started back, in the 90s up in Boston, was, man, there are a lot of allies out there beyond clinical care, and among the most effective in this situation are legal advocates. And so what does it take to have a relationship that is as if it was a cardiologist on my right, a pulmonologist on my left, a dermatologist in front of me, but like, how do we actually sync up care as seamlessly as that? So the way it works with us is we have standardized a set of simple questions, straightforward questions that we ask families when they come in for well child care and sometimes for ill care. These questions try to assess some of those hardships going on in their life in a very respectful, safe way. And the questions are co-created with our legal advocates. So we're not asking social screening questions that we can't do anything about, but carefully co-constructed with our social workers and our friends at Legal Aid Society of Greater Cincinnati over 15 years ago are these questions that are now embedded directly into the electronic health record. And if a family, feels comfortable saying yes and says they would like help, we've actually built into our system, after a conversation with the family and their permission, to do a direct referral to the Legal Aid Society. So just as I can hit a button and get you a referral to a cardiologist, I can hit the button and process that. It processes out to the Legal Aid Society, where they can help pick up the referral and be in touch with the family. In one of our practices, they're actually embedded directly in the clinic. Just as I might point a family to the nutritionist in room X, we might have a legal advocate who can pop into the room. So what are the kinds of issues and how many issues do we see a year? Well, with that volume, Elaine knows this all too well, like over 1,000 referrals per year we send from our 6 primary care practices to the Legal Aid Society. Roughly a third relate to housing conditions, roughly a third relate to Medicaid and public benefit, and then a third an array of other issues. And Elaine can take you a little bit deeper into the kinds of advocacy they do, but including education, family law, and so on. And what that does is unburden clinicians to be their best clinicians, and through their trusted relationship, give exquisite access to the medicine the families may actually need. So again, when I'm facing a kiddo who might have had asthma and been hospitalized twice, I can just double the medicines. I can prescribe a new, even more expensive medicine. Or when a family says, we have water damage, a rental unit, we have water damage, the landlord isn't doing anything, the far smarter thing for the kid's health, the far more cost-effective thing to do is to partner with a legal advocate to try to address the underlying condition instead of pouring expensive medicine in. And so you might ask, well, how do you know this works? Is it really effective? Just in our limited time, and we can come back to any piece of what we've shared. We recently published a study, and in a minute I can pop the link into it, but in partnership with Legal Aid, We looked at over 2,000 referrals to legal aid. We looked at the rate of hospitalizations the year prior and the rate of hospitalizations the year after they had had a legal aid consult. And then we compared them to over 30,000 kids who were matched by age, by the neighborhood they lived in, by the kinds of health they've had and prior hospitalizations. What we found is a 38% reduction in admissions among those kids who had been referred to legal aid compared to these matched kids. Now, we can't randomize kids for that kind of help, but in a pretty rigorous study, a 38% reduction. And I'll just finish by saying, like, imagine Medicaid or policymakers was faced with the opportunity to pay for a new pill that overall, across all conditions, reduced admissions by 38%. Even if it was 20%, like pharmaceutical companies, payers would all be like, I want to pay, I want to help with that medicine. And so I think the real opportunity here is to think about how can Ohio as a whole, like, lead the country in thinking about advancing a new way to practice medicine in which we get extraordinary outcomes, not because we rely only on clinicians, but we think about great partnerships too. So we're happy to take some questions later, but just wanted to give you a flavor of how this works and its kind of impact. I'll turn it back to you.
Thank you, Dr. Kahn. That was very insightful and eye-opening. Elaine, would you like to give us your brief remarks?
Absolutely. Good morning and thank you. It is exciting to share my experience about how doctors and lawyers working together can make people healthier. Civil legal advocacy has an important role to play in addressing root causes of illness for low-income families and persons of color. Those root causes are often many of the social determinants of health that undermine people's lives and create barriers to their health. As you know, legal aid serves low-income persons. That is the mission of all the legal aids throughout Ohio, to provide civil legal advocacy to individuals and families to resolve serious legal problems on the civil side. So therefore, medical legal partnerships, or health law partnerships, as we call our programs in Southwest Ohio, they not only promote better health outcomes, but they are an effective strategy to remediate race and income-based health disparities and improve health equity. You may ask, so when a lawyer or a trained legal advocate is part of a healthcare delivery system, what is different? Well, to start with, many people, no matter their education level or income, do not know that legal advocacy might be able to resolve their problem. It's by no means clear to any of us what a lawyer might be able to do to help or when that might be possible. So our clients typically are not about to contact a legal aid office, but when their trusted healthcare provider makes the introduction, they feel safe to move forward. But in addition to that, there is a huge unmet need for civil legal advocacy. In fact, we are only able to address about 20%, to meet about 20% of the need for civil legal advocacy for low-income families. That is not only true in Southwest Ohio, that's true statewide and nationwide. There are insufficient resources to provide civil legal advocacy for low-income persons. However, when someone is referred through a health law partnership or a medical legal partnership, that increases their access to legal advocacy. Rob told you about our partnerships in the primary care space with Cincinnati Children's, what we call Child Help, and in subspecialty care with the Health Equity Network. I also want to mention a third partnership that we have that relates directly to House Bill 7, which is the Maternal Health Law Partnership. And it is between Legal Aid and Tri-Health. And in this partnership, very similarly to what Rob described, we take referrals from healthcare providers who are seeing pregnant women in the primary care space. And we train them on social determinants of health and the subset of those that we call health harming legal needs. In other words, social determinants of health that legal advocacy might resolve. And with the consent of those women, the prenatal providers are referring to legal aid pregnant women with issues so that we can contribute to better health outcomes. So you might also ask, what exactly can legal advocates address when working with healthcare partners? Rob gave a few examples. Let me be a little more specific. When a pregnant woman is threatened with eviction and homelessness, our advocacy can keep her in her home. When a woman is living in substandard housing and has extension cords going all over her apartment because the wiring is inadequate, we can enforce building and health codes so that to secure repairs so that she and her children are safe and she can bring a baby home to a safe apartment. When a pregnant woman is wrongfully cut off from SNAP benefits and she and her 2 young children do not have enough to eat, we can secure quick relief. When a child is proposed for expulsion, we can keep that student in school and reduce the risk to his pregnant mother that she will lose her job because she has to stay home with her child who can no longer attend school. And equally importantly, since pregnant women are at higher risk of domestic and partner violence, when a pregnant woman does experience that violence, we can secure a protection order to keep her and her children safe from harm. Barriers to good health prevent so many Ohioans from being productive citizens. Low income and persons of color are especially vulnerable to poor health. When we provide legal advocacy in intentional coordination with doctors and other healthcare providers together, we can contribute to the social and emotional well-being of children and to their resilience. And we can work to better the maternal and birth outcomes for pregnant women. Thank you.
Thank you, Elaine. That was very insightful. Susan?
Good morning. Thank you to Groundwork Ohio for sponsoring this webinar. I appreciate the opportunity to join this panel to discuss medical legal partnerships in Ohio. So I'm going to talk just a little bit about MLPs statewide for some additional context. You've heard the great experience in Southwest Ohio, but there are more than 25 MLPs in the state, and some of them do serve specific populations like children, or where they focus on healthy birth outcomes and serve pregnant women and children. And others serve a more general population or are focused on addressing chronic healthcare needs or chronic diseases. MLPs have been around in Ohio for a while. The first MLP began in 2003 and was a partnership between the Legal Aid Society of Cleveland and Metro Health Medical Center Community Advocacy Program. It's still operating today. So just a little more about the statewide context of building on what Dr. Kahn and Elaine talked about as their experience. In 2022, the partnerships with legal aid offices resulted in nearly 3,300 cases involving households that had 7,000 children and 4,400 adults. So you can see the reach of the MLPs across the state. And mirroring what they see in Cincinnati, more than 1/3 of the clients served received legal assistance involving housing issues like evictions and housing conditions, the examples that Elaine shared. Other highly needed services statewide are similar to what you heard Elaine and Dr. Kahn mention. They involve income and public benefits, family issues like custody or domestic violence, and education issues. Dr. Kahn mentioned the great study and success of the child health program in Cincinnati. And then the National Center for Medical Legal Partnerships out of George Washington University compiles research and evaluations of other MLPs. So we know that these other studies show success when legal expertise and services are used to address social needs. We know that people with chronic illnesses are healthier and admitted to the hospital less frequently, saving healthcare costs. People report less stress and experience improvements in mental health. People are more stably housed and their utilities are less likely to be shut off. And people have access to greater financial resources. And those are some of the, the findings of MLPs that exist in Ohio and across the country. And I'd say the experiences in Ohio mirror the successes of those studies. So I look forward to more discussion and questions and answers. Thank you.
Thank you, Susan, for that, giving us insight and a broad perspective of MLPs across the state. I will now move forward to asking questions directed at each of the panelists, and I'll begin with Dr. Kahn. So Dr. Kahn, you, I think Elaine talked about how patients tend to trust medical providers better. So I was wondering how you've resolved trust issues between your patients to help them feel comfortable to be recommended for legal assistance.
Sure. And I appreciate the question. And sometimes I think the trust proposition and the value proposition are like the two biggest things in all of medicine to get over. So resolution of trust would be probably an overstatement, but building on what's good about this relationship to be trustworthy, I think has been important. So first, I think, acknowledging the reasons there might be distrust, right? You come forward to a family with the wrong body language and the wrong words and say, I'd like to get a lawyer involved in your family's care. Wrong way to do it. But rather, how do we set a tone and a culture and a vision in pediatric care or obstetric care or elsewhere that the health of the child is more than the shots that child's going to get today, right? So what are the parents' aspirations? What are their struggles? What are their hopes? And how can we be more present for everything they want for their child? And in a very busy practice and not a lot of time and understaffed, sometimes we lose that. But I think I would argue we can't afford not to spend that kind of time setting the tone with families. So a broader vision, I think a warm front door. How do we welcome families in? And show that dignity and respect as they arrive. And finally, trying to build a clinical culture that says, while their first response might be, I don't have time to open that can of worms with these questions, is flip it and say, first of all, why are we here? We're here to help every kid, every child thrive. And second, we don't have time not to, right? Do we want them to come back for 4 more asthma visits because all the foundational conditions are exactly the same? Or do we make that time up front to address these issues? And I think what happens then is we get a positive loop. So our partners at Legal Aid will send the results or the outcomes back with the family's permission, and that empowers clinicians. And then they start to approach this in a different way. Wow, I almost didn't even ask that question. And here now I'm hearing mom had the SNAP benefit issue resolved or the housing is resolved. And that presence of a clinician who knows that they can share those kinds of assets, I think is key part of building trust. So we have a ways to go, but delivering for offering services and delivering for families, especially beyond routine care, is a great way to be trustworthy and build trust with families.
Definitely. Thank you so much for that, Dr. Kahn. And even the follow-up after that, you gave an example, but my next question was going to be if you have an example of how MLPs have been beneficial to the lives of families and patients that you've had contact with, if you'd like to highlight any of the stories.
Yeah, I mean, again, with 1,000 referrals a year, we could do lots of them. I'll send another link to one of our earliest cases that built a tremendous amount of will. It was a family of a child with asthma. It was roughly 2011 in Cincinnati, very hot summer. And the landlord had said, if you put an air conditioning unit in your apartment, you will be evicted. And it posted that. We ended up with about 3 or 4 referrals where families were saying the threat of eviction. I'm going to cut all the way to the end. It turned out there were something like 19 buildings owned by a single absentee landlord who was on their way into foreclosure, and over 700 units worth of families and kids across those buildings. And legal aid achieved something that no individual level care for a given patient would have achieved, which is repairs to the buildings that ultimately led to like choice grants, and all of those large buildings have been refurbished. So like that's the big scale all the way down to the kind of mother of a newborn who doesn't know, is the SNAP benefit moving forward? Is there a problem? Such stress. How can a mother breastfeed when they're so anxious, they're not sure they can put food on the table, and they're struggling with a SNAP benefit, to like that moment of relieving a mother that she has an ally now and an advocate.
Thank you so much, Dr. Kahn. Elaine, in your experience in establishing various MLP programs across the state, how do you see the grant money directly benefiting various MLP services that exist and the ones that will be established?
Funding is always complicated, and I'll start by saying that because of what we've already mentioned about the unmet need for civil legal advocacy, it means that legal aid programs have to make hard choices about priorities and have to decline eligible individuals and families who in fact have serious legal needs. So funding to utilize legal advocacy to address social determinants of health, to contribute to better health outcomes, means that in whatever way the particular partnership is set up, and they certainly vary, but it increases the access of an individual person or family to legal advocacy. Since our clients are exactly the Ohioans who are at most risk for poor health, low income, and often persons of color, it means that we are able to make an impact for them right in that space. We had grant money initially to create the maternal health law partnership that I referred to, and we started taking referrals in 2017. And so that program is still going on, but I'm sure it's true for other programs across the state. If we had additional funding, we could expand more pregnant women. In the case of pregnant women, like HB7, more pregnant women would be screened for social determinants of health and could be referred, and they could access that help. We all know, it's well documented, that Black women have higher rates of poor maternal outcomes and increased risk of preterm birth. And since that's who our clients are, it is really important to try to find ways to increase access and advocacy in that space.
Definitely. Thank you so much, Elaine, for that answer. And since you mentioned social determinants of health, and you talked about it in your remarks, in your experience in meeting the needs of Ohioans across the state, how does legal services directly break the cycle caused by social determinants of health?
Well, I think that social determinants of health create, when they're negative determinants, which they so often are for poor people, then they create barriers to health and health outcomes. And so resolving and addressing that issue, be it hunger, bad housing, a custody issue, or domestic violence, kind of can liberate the person in the household to then achieve better health, to attend prenatal appointments, to take their child back to the pediatrician for her follow-up ear infection visit. In other words, when we can address the housing, the hunger, the school issues, the domestic violence and other family issues, or immigration sometimes, then those that we know undermine people's health and mental health, when we can resolve that, then they have a chance of accessing health through this type of coordination.
Definitely. Thank you, Elaine. So Susan, you gave us a little bit of like a statistical overview or of the different MLP programs across the state, and you've shown us that MLPs do work. Can you tell us what makes this partnership work and what sets it apart when compared to other policies that legislatures have tried to push in Ohio?
Thank you. And I know there was a questions about House Bill 7 and medical legal partnerships. So just to put some context on what is in House Bill 7 related to medical legal partnerships, it would establish a grant program through the Ohio Department of Health to fund, to award grants to legal assistance organizations and medical providers that partner together to identify pregnant women, mothers, and children in need of legal services to provide them with those services. So that's the specific part of House Bill 7 that looks to medical legal partnerships. I think what MLPs show is that providing services collaboratively and holistically help improve outcomes for children and families. There was such passion from Representative White and Representative Humphrey as they introduced this bill and provided sponsor testimony. Representative White in her sponsor testimony acknowledged that Ohio's health outcomes for maternal and infant health are unacceptable. And I think that's what's driving the discussion around this bill. More mothers are dying from causes related to pregnancy and childbirth in Ohio than any other state. And more than 1 in 150 Ohio babies don't live to see their first birthday. And the gap in racial outcomes for infant mortality between Black babies and white babies is alarming. And that's what's behind this comprehensive look at addressing these issues. So House Bill 7 is that comprehensive look to improve infant and maternal health outcomes. And by including MLPs, the bill sponsors and supporters of the legislation are recognizing the role that legal services play in improving health outcomes. We're grateful to see that MLPs are included in the bill, but making these collaborative services as a normal part of today's healthcare system will still require a culture shift. And the grant program proposed in House Bill 7 and discussions like this today on this webinar is a great start in that cultural shift and how we can better deliver those services collaboratively to improve health outcomes.
Thank you, Susan. I remember Dr. Kahn mentioned about that MLPs was initially started in Boston. Susan, I was wondering if you know of any other state that has like successfully passed this partnership as a policy or a bill.
So medical legal partnerships exist in 49 states in the District of Columbia. So they are widespread. And I did mention the National Center for Medical Legal Partnerships, which is housed at George Washington University. So they do provide research, evaluation, and technical assistance to MLPs. So MLPs are funded in a variety of ways, information from the National Center. So there is some government support for MLPs, but most of the funding comes from, they report that most medical legal partnerships receive funding from a variety of sources, but more than 1/3 of medical legal partnership programs receive some of their funding from healthcare organizations' operating budgets. But we know that providers' budgets are tight too. Other resources, come from the legal services community, but some examples, and of course, private and corporate philanthropy grant programs also fund MLPs. But we've seen other states to leverage insurers and particularly their Medicaid managed care contracts to include legal services in their case management services. So that's just another aspect that can from a policy perspective, be explored to expand the reach of medical legal partnerships. So we have seen some of that work happen in other states.
Thank you, Susan. Thank you, and thank you to the panelists. So you guys have been amazing. You answered all the questions amazingly and opened our eyes to the world of MLP partnerships and how this could look for Ohio's future. My last question, which is directed to all the panelists, is, Elaine, yeah.
Casey, I understand there is a question about what are the most common types of legal support that is needed. And I just want to, sorry for interrupting you. I just wanted to get to this before the end and respond. And maybe, Susan, you can then give a statewide perspective. I can tell you in our partnerships in the pediatric space where we serve households of children and families, and in the maternal health law partnership serving pregnant women, housing is, for some years, certainly since the pandemic, housing has always been and is always the leading cause for referrals. So it might be eviction related, it might be conditions related. There's a lot of housing, and there is a lot of need for information and for action. And so that's number one. And close second, sometimes close to tying with housing, but is our benefits issues. And now we're talking about SNAP, food stamp type benefits. We're talking about cash assistance. There might be SSI. It might have, in other words, we deal with all the public benefits in our office, and benefits related issues in both pediatric space and pregnant women are very critical. I can say that education is the third for families with children, because there's lots of issues relating to children's health, mental health in school, in their school success. However, for pregnant women, we find that family law issues related to rights of a baby daddy to come to the hospital, custody issues, partner violence, like I've already mentioned today, those are the third greatest areas. And then we have a lot of other miscellaneous issues. But that's my response. And I just want to say, before I see if Susan wants to add anything statewide, we work well in partnership with social workers and community health workers. They, of course, are filling critical needs already. But what we have learned is that community health workers and social workers can help identify the issue. They cannot fix it. They are not trained legal providers. And so when we look at what does House Bill 7 offer that is different from what exists now, there's plenty of need to go around for all of us. And what we have learned through our health law partnerships, our MLPs, is that trained legal advocates have a critical role to play in resolving these issues that can then promote health. Thanks. And now, Susan, do you have anything more to say about it?
I would just say the statewide data mirrors exactly your experience. The most sought after legal need, or the most prevalent legal need, is housing related issues. And then it's income and public benefits, family law issues like custody and domestic violence, and then education. So those are the similar most sought out legal needs statewide as well.
Yeah. Thank you both. Thank you, Robert, Elaine, and Susan. My last question will be directed at you all. It's, what advice would you give lawmakers regarding the effect of medical legal partnerships in the state if House Bill 7 is passed?
I can go first. I will say we've talked a little bit about the gap in the ability to provide legal services that are needed by low-income Ohioans. And in addition to that reported gap, we learned that there's the actual gap is larger because many people don't even know they need legal services, or that they have a legal issue, or they're unaware of how how an attorney can help. So we've learned that a referral from a trusted medical provider can help make that connection. And then I'll just quote some more national data. A survey of health center MLPs showed that 80% identified funding as the primary challenge to sustaining or expanding medical legal partnerships. So what do we know? We know medical legal partnerships they solve legal issues, but they improve health outcomes, stabilize families, and they save money. So directing resources to MLPs is a wise investment for the state. It is part of that comprehensive look at improving health outcomes for young children, pregnant mothers. The grant program in House Bill 7 is a great start to sustaining and expanding the reach of the critical legal services delivered by Ohio legal aid offices across the state. So I would say pass House Bill 7.
Well, I can join basically and echo and affirm Susan's remarks, because you have said the most powerful and given the most powerful responses. And I think as an attorney with an integral and lead role in medical legal partnerships for these past 15 plus years, there's a lot to say that we've already alluded to today about the space, like Susan said, the health harming legal needs are the gap that we fill. And without us, there are many issues that our low-income community faces that individuals and families are dealing with that are barriers to their health. And without legal advocacy, they cannot close that gap. If you take a few minutes to watch, on top of listening to Rob Kahn today speak, take a few minutes to watch the video that is in the chat. It was a video created by Legal Aid and Children's Together to celebrate our 10-year anniversary of Child Help. It's now our 15th year. But rather than hear me say another word, it's to hear the healthcare folks, Rob and his colleagues talk about the impact and how they don't want to practice medicine going forward without access to trained legal advocacy. That's what lawmakers need to understand. And that's why people should want to, jump on to support for House Bill 7.
I'll just add from a clinician perspective, like Ohio has the chance to lead the country. So while there are medical legal partnerships around the country and many very good ones, I think Ohio is 2 steps ahead, and passing this would take us even further, especially on a path to making what's extraordinary care become the ordinary with sustaining funding. And I just don't want us to lose sight of what's really important to families. And it's not just the right thing to do for kids, it's the cost-effective thing. I looked up what's the NIH budget each year to discover brand new things. $48 billion a year to discover new things. Here we have something in hand that reduces healthcare costs, improve outcomes, and is a lot less than $48 billion a year. So I really hope this moves forward, and Ohio shines by doing it.
Thank you all. We have one, I think the other questions from our audience members have been answered, but we have one question that just rolled in. This individual said, aside from reliable and stable funding, what other challenges facing the success of MLPs? Oh, I just lost it. Let me read it again. As I was reading it, okay, I found it. So it says, aside from reliable and stable funding, what other challenges facing the success of MLPs, either on the patient/family side or legal/medical provider side? So what other challenges faces MLPs aside from stable funding?
I'll let my lawyer friends go first.
Well, I think in our experience, communication between the legal advocates and the healthcare providers is critical. Rob already mentioned trust. I mean, communication to create an effective partnership, to share management, to problem solve together, to talk about what can we do better, to talk about what's working, what's not. That is key. And I've seen that when that is missing, when close communication, coordination, and investment by both parties, shared shared investment in the outcomes, when that's not there, it's going to hamper the effectiveness. It's really, and so with that, with resources and that, and in our experience with Children's and Tri-Health, we have identified key ingredients to success of effective health law partnerships. We know what needs to happen. And I think that goes to Rob saying Ohio is ahead of the game. We can move forward further. And some of us who've been doing this know what needs to happen to be effective in this work.
Maybe I'll just add from the clinical side, I touched on it earlier, there's still a mindset shift that has to happen, that our job is not delivery of vaccines for those who come in the door, or lead testing, or managing the asthma that's in front of us. And I think with that comes challenges of time. So to do that quality communication and management that Elaine talked about is not just commitment, but then how do you free up time in the day? And any practice that's serving obstetric or pediatric, serving low-income families, is on a razor-thin margin at best, if not losing money. So I think vision, time. And the last one I'll just say is legal aid, critically important. And then some of the wraparound additional components. How do we get the right social work? How do we partner up front with Head Starts and JFS and others? So I think in the end, I hope this is a first step towards that fuller package that says, you know, Ohio can make sure we achieve our vision for kids together.
That is wonderful. That is wonderful. Thank you, panelists. I appreciate you so much. Groundwork appreciates you so much for just your contribution in the work on the medical legal partnership field. Thank you all for taking time to join us for this important discussion of the essence of medical legal partnerships on the future of healthcare and legal access in the state of Ohio. I would like to once again appreciate our esteemed panelists, Dr. Kahn, Elaine Fink, and Susan Yeagers, for an insightful conversation regarding medical legal partnership. This webinar would not have been possible without them. We appreciate you all so much for your efforts, alongside with everyone who tuned in to join this conversation to learn more on this topic. Your presence is greatly appreciated. House Bill 7 comes with various other provisions that Groundwork Ohio has taken time to highlight throughout various blogs. Please visit the news page on our website to access these resources. Also, please feel free to share the resources that were linked in this webinar and the resources at our news page on Groundwork Ohio in your engagement with legislators and various stakeholders regarding House Bill 7. I also urge you all to contact your state representatives, asking them to vote a yes on House Bill 7, as it's looking like it will be introduced on the House floor this fall. So now is the time to reach out to your representative to urge them to vote yes on this bill. Additionally, on this slide, there's a QR code on the bottom left side. If you could take time to fill out the survey on what you think about this webinar, it would be very much appreciated. You can find the survey once again at the bottom right side on this slide. Lastly, Groundwork Ohio will be hosting a Momentum Institute on Thursday, November 2nd, 2023 from 8 a.m. to 4 p.m. The link to register for this Movement Building Institute can be found in the Q&A box. Thank you all for your patience, and thank you all for joining us in this wonderful conversation. We hope this conversation and this discussion will drive the topic of medical legal partnerships and other endeavors to help mothers, families, and children. It will drive such conversations forward and hopefully produce fruits and benefits of other policies and conversation to help the lives of families across the state. Thank you so much for joining Groundwork Ohio once again on this important conversation, and I hope you all have a wonderful rest of your day.
Thank you all for listening. Thanks for the opportunity.
Thank you.
Thank you.
Thank you.